Hello and welcome back to my YouTube channel. My name is Maureen Sullivan. I'm a registered nurse, a certified diabetic educator, and a certified emergency room nurse. And today's video, because it is October, is all about breast cancer awareness. So I've got some statistics and some great information here. So sit back and just give me a few minutes of your time here, and it's a win-win situation. So what can I say about breast cancer awareness? If you go out into any stores, any businesses, etc., you're going to see pink everywhere. And that is a reminder that it is breast cancer awareness. So support, nonprofits and support purchases that go towards the, treatments of men and women with breast cancer awareness. Be sure and check out really reputable websites on breast cancer treatment options, including the American Cancer Society and the Breast Foundation. So today's video, there are some statistics I want to share with you, because I know initially the first lines I'm going to give you is very daunting, but then I'm going to follow it up with something really exciting here. So the first one is 1 in 8 women will be affected by breast cancer in their lifetime. That is equivalent to over 2 million women worldwide. That's a daunting number here. The flip side, because there always has to be a win-win situation here, is that with early detection and treatment, the survival rates at the 5-year mark for breast cancer patients is over 99%. So yes, 1 in 8 women, and I say women kind of hesitantly because men can also be affected by breast cancer, but 1 in 8 will be affected, but a 99% survival rate with early treatment and detection. So what can you do to make sure that you're in that survival group there? And there's some basics here that we can all adhere to just to give us a better chance at lowering our risk for cancer. So breast cancer awareness, breast self-exams. Check with your healthcare provider. Get to know your breast. No pun intended here. I'm not playing a game here. But monthly breast self-exams, you know best what you feel like. I don't know how else to say that. And what you look like. So check yourself in the mirror and check yourself manually and check for any unusual, drainage, discharge, lumps, bumps, anything. And by all means, check with your healthcare provider if you find something. And do not panic should you feel a breast cancer suspected lump or a bump here, because the truth of the matter is 8 out of 10 lumps that are detected are actually non-cancerous. So that, again, that's a really strong statistic to share. When it comes to mammograms, the recommendation is that they should start for women at age 40, and they should be done every 1 to 2 years. That is somewhat insurance driven, but there are, in my opinion, professional opinion, there are exclusions to that. And it's very important to tell you, if you have a high risk factor for breast cancer, if you have family members, multiple family members with breast cancer, and you've got some genetic tie-in to a higher risk here or a higher than normal risk, check with your provider and get them to do an exception to that baseline at 40, because we all know, myself included, people diagnosed with breast cancer before the age of 40. So that was a generic cut point in terms of insurance companies to start the screenings at 40, but there are exceptions available to that. So in the meantime, what can we do as an individual, as a society, to lower our risk of all types of cancer? And here it is, folks, the basics. It really is basic overhaul of our current lifestyles. And everybody, myself included, can come up with some situations in my life that need to be improved here. So in no particular order, again, because it's going to depend on what actually clicks with you and goes, yeah, maybe I could do something better there. We need to eat better in terms of whole foods and fruits and vegetables and lean meats instead of processed and refined and packaged foods. We need to go for the fresher fruits and vegetables instead of those that are, I hate saying it, dripping in those heavy syrups. And yes, I know everybody's like, hey, but they taste good, but they're not really good for us in the long run. So decide what battle you want to choose, I guess, right? And the other thing is activity. Everybody, I think pretty much everybody can find some need in their lifestyle to lower their stress levels and help them sleep better. And for me personally, that was increasing my activity level. Not to the point of exhaustion, not to the point of extreme marathons, but look at your daily lifestyle, put on a fitness tracker and see what happens. And then just find ways to incorporate more activity into your daily life. And it's a win-win. You will build muscle, you will probably burn some calories, you will also improve your sleep habits and lower your stress levels. So again, find an activity that you like, start slow, add some, little movement into your day, and you'll be a better person because of that. The other thing is smoking cessation. And I know that it's a stress reliever for a lot of people, but if you're smoking cigarettes, tobacco products, cigars, and even vaping, that is something to really consider stopping. Talk with your healthcare provider and discuss what may work for you in terms of getting you no longer dependent on tobacco products. And by doing so, you lower your risk of all types of cancer, because whether it be lung cancer, breast cancer, and that, there's a tie into tobacco products. So everybody, including myself, knows somebody that smoked till they were 100 years old and never had any health issues. And I applaud that, that was their destiny, if you will, but that is not the norm across the board. So look in your personal lifestyle and your daily activities and find ways, just small, simple changes that you can improve your overall health and well-being. Nothing drastic, nothing extreme, just improve, take one area at a time and improve it, and you're going to see benefits across the board, lowering your risk of cancer, lowering your risk of chronic disease. So like I said, for more information, Breast Foundation is a good, reputable website. You've got WebMD, you've got Mayo Clinic, and of course the American Cancer Society. So for now, appreciate your time, wishing you good health, and let me know in the comments what other videos that you might be interested in seeing, or your experience in the cancer arena, if you will, and together we'll be moving forward for a healthier journey. Have a great day. Again, my name is Maureen Sullivan, and my website, subtle, MaureenSullivanRN.com. Bye-bye.